has to be put in your presence only. And proper storage, I don't think we have storage facilities in the periphery, but you should demand, you should ask your MS or BMO, CMO, whosoever is in the periphery, that you should be provided with a refrigerator exclusively required for a mortuary. The viscera that you have extracted, that should be preserved at least for a day or so before that is being dispatched to FSL or for histopathology. That should be stored at a proper temperature. Viscera samples must be stored in appropriate conditions, such as airtight containers, tubes, and maintained at the proper temperature to prevent degradation of the samples. Then labeling and documentation, detailed labeling and documentation of the collected samples, including patient's information and time of delay, time and date of collection. I have discussed about this yesterday also. Whatever you do in medical legal practice, always make it a habit to mention your date and time and place of examination. And chain of custody is the essential in the integrity of the evidence. Proper labeling and handling of samples. Identification, clearly label each sample with the patient's name, date of birth, and type of sample collected. Packaging, place the samples in an appropriate container such as sealed vials or bags to prevent contamination or leakage. Storage, store the samples at the required temperature, either in a refrigerator or frozen, to ensure samples integrity and preservation. Transportation, arrange for the secure transport of the samples to the appropriate laboratory or forensic facility, maintaining the chain of custody throughout the process. So that's not your part, but that has to be, you have to guide the police officials, because most of our police officials in the periphery, even in medical colleges, they are not well versed with this chain of custody and how to really maintain this chain of custody. So you should properly guide them how to dispatch the samples and how to get a receipt wherever you have submitted that sample. So coordination with law enforcement agencies, that reporting requirements. In many jurisdictions, medical practitioners are required to report the suspected cases of poisoning to the appropriate law enforcing authorities or public health authorities. So providing information. The medical practitioner may be asked to provide detailed information about the patient's condition, the suspected poison, the samples collected to aid in the investigation. And chain of custody, again, maintain proper documentation and a clear chain of custody for the collected samples to ensure integrity of the evidence. And collaboration, effective collaboration between the medical practitioners and law enforcement agencies can help expedite the investigation, identify the sources of poisoning, and prevent further incidents. Provision of appropriate treatment and antidotes. So you should at least know the basic antidotes required in most common type of poisons, and at least, if not, but you should know about what are few universal antidotes when you don't know the nature of the poison. So specific treatment providing supporting ways such as administering fluids, managing pain, and supporting patients' vitals functions. Then when available, the timely administration of specific antidotes can help to counter